Hi everyone, my name is Sharanya Kumar and I'm a second-year internal medicine resident at Riverside University Health System. I just wanted to say thank you to MOAS for giving me the opportunity to present this case series today. I'll be presenting a case series titled Extramedullary Disease Progression Following Blinatumomab for B-ALL, Salvage with Inotuzumab Ozogamicin, which was conducted in collaboration with the Hematology Oncology Department at Cedars-Sinai. Blinatumomab, a CD3/CD19 bispecific T-cell engager, is an established treatment for relapsed or refractory B-ALL. While it has demonstrated efficacy, there are reports of new-onset extramedullary disease, or EMD, developing post-treatment. This poses a significant clinical challenge, as EMD can be difficult to treat and may impact survival outcomes. Inotuzumab, Ozogamicin, an anti-CD22 antibody-drug conjugate, has demonstrated efficacy in B-ALL with EMD, but its role as salvage therapy for post-Blinatumomab EMD is not well studied. Our study explores 5 such cases and evaluates the response to Inotuzumab. Table 1 shows a figure that discusses the 5 patients who were analyzed and includes data regarding age, cytogenetic profile, initial treatment, as well as outcomes after treatment with both Blinatumomab and subsequently with Inotuzumab. Patients were mostly male, 4 out of 5, with a median age of 36 years. None of them had pre-existing EMD. All had a high blast burden at initial diagnosis, with a median blast count of 89% and various cytogenetic abnormalities, including IgH rearrangements, pH-like status, IgH-CRLF2 fusions, TCF3 PBX1 gene fusion, and complex karyotypes. The most common induction regimen was hyper-CVAD. EMD sites varied and included the orbit, testicle, submandibular region, subcutaneous tissues, and retroperitoneum. All 5 patients received Inotuzumab for EMD salvage therapy. Patient 1 achieved measurable residual disease, or MRD, negativity after Inotuzumab, successfully underwent allo-HSCT, and remains in complete remission at the 1-year follow-up. Patient 2 was scheduled for allo-HSCT but experienced disease relapse and was started on Blinatumomab. He developed EMD and received 2 doses of Inotuzumab for debulking prior to undergoing experimental CAR-T therapy. Unfortunately, he developed neutropenia and died from E. coli bacteremia-related complications. Patient 3 achieved MRD negativity and radiographic resolution following Inotuzumab, but later succumbed to renal failure after CAR-T therapy. Patient 4 continues to show clinical improvement following Inotuzumab treatment, and patient 5 recently started Inotuzumab and requires ongoing monitoring to assess response. Now moving on to the discussion. Several mechanisms may contribute to EMD following Blinatumomab therapy. One of the proposed mechanisms is CD19 negative antigen escape, where leukemic cells lose CD19 expression, rendering them resistant to Blinatumomab. Other possible mechanisms include impaired T-cell infiltration, ineffective pharmacokinetics, and CD81-mediated CD19 trafficking deficits, which may contribute to treatment failure. Blinatumomab relies on functional T-cells to eliminate CD19-positive leukemic cells. However, many leukemic patients, especially those who have undergone prior chemotherapy, experience T-cell dysregulation, which may limit the effectiveness of Blinatumomab. Additionally, the inadequate trafficking of T-cells to extramedullary sites may further reduce its efficacy. Lower Blinatumomab concentrations in the extramedullary sites, combined with the reduced T-cell access, may allow leukemic cells to persist and invade these regions. Furthermore, insufficient drug penetration into the CNS or other poorly vascularized tissues may contribute to disease relapse. In contrast, Inotuzumab targets CD22 directly and delivers a cytotoxic payload independent of T-cell function. This mechanism suggests that it may be effective in cases where Blinatumomab fails due to T-cell limitations. However, further studies are needed to define optimal treatment. To conclude, new-onset EMD has emerged as a recognized complication in patients receiving Blinatumomab for relapsed and refractory B-ALL. Inotuzumab Ozogamicin shows promise as a salvage therapy in these cases. However, further investigation is required. Thank you so much for your time and the opportunity to present this case series.